Hello, I'm going to do my report on child restraints. My name is Danielle Ricks and I attend College of St. Mary. So why are child restraints a health issue? Well, many children are unrestrained or restrained improperly while they're traveling in a vehicle. The leading cause of death and disability in the United States for children is from motor vehicle crashes. Each day, 5 children, 14 years old and younger, are killed and 568 children are injured in motor vehicle crashes. Failure to use the appropriate size of car seat is the most significant risk factor in a crash. As I was doing my research, I found out that there was an inconsistency in state laws. The first state law protecting child passengers was in Tennessee in 1978. 47 states have laws protecting children older than 4 years old. The different state laws vary by weight, height, and age. Many state laws do not address the importance of proper restraints for children 3 to 8 years old. Choosing the proper restraint is very important. However, many parents move their child to the next seat without knowledge of age, height, and weight requirements. In this image, we can see that there's different kinds of car seats: a rear-facing car seat, a forward-facing car seat, a booster seat, and then just using the adult seat belts. It is recommended that a rear-facing car seat should be used from birth to 2 years old. A forward-facing car seat should be used from 2 years old up to at least 5 years old. A booster seat should be used from 5 years old up until the seatbelt fits properly, and a seatbelt should be used once it fits properly, typically around 8 to 12 years old. There was a report done by Ebel and Associates on the statistics of proper restraint use, and in their research they found that the category from 0 to 2 years, more than 80% of children are restrained properly. At 3 years old, it drops down to about 60%, and from the 4 to 8 year old range, it's under 20% of children. It climbs back up at 9 and 10 years of age in the 60% range, and this is due to children being bigger at that size and the adult seatbelt fitting properly. How do you know when your child is ready to move to the next restraint? The American Academy of Pediatrics recommends using child size rather than child age for transition to the adult seatbelt. A child should stay in their car seat and booster seat until they reach the weight or height limit of the seat. When moving to a seatbelt, the recommended height is 57 inches tall. A properly fitting seatbelt is established when the child is able to sit back against the back of the seat. The lap portion of the belt will ride low over their hips and is held in place by the superior iliac spine. The shoulder portion should cross the sternum and the shoulder, and forces in an accident are dispersed over those bony structures and away from soft tissue. And as I said before, a proper fit is usually achieved around 8 to 12 years old. There are car seat regulations. Every car seat has a sticker on it with proper installation information. Height and weight limits are listed on the sticker and may have limits up to 120 pounds. Each car seat has an expiration date printed on it, and makers are required to conform to the Federal Motor Vehicle Safety Standards. There is lower rates of car seat use seen in specific populations, so this could be a social problem. In rural areas, those with a lower education, low-income populations, African American, and Hispanics. So when trying to address this would be a great population to make aware of these seatbelt and car seat laws. The reports found that there were specific reasons for not using car seats, and 56% of these parents interviewed said that their child is too big and doesn't need a booster seat. They also reported that their child doesn't like it, they were in a hurry, they were only in the car for a short time, or the child will not stay in it. Now, this is a health problem because injuries can occur in car accidents for children that aren't restrained properly. These injuries include lumbar fractures, head, neck, and abdominal injuries, spinal cord and brain injuries. They also are able to submarine or slide out of the lap belt. And 2/3 of children will place the shoulder belt behind their arm or back. This is a clear indicator that the seatbelt does not fit them properly. Research has shown that when restraints are used properly, the risk of death is reduced by 71% for infants and 54% for toddlers 1 to 4 years old. The risk of injury is reduced from 59% when using booster seats compared to seatbelts, and since 1975, an estimated 10,673 lives were saved due to child restraint use in children 5 years old and younger. Patient education is very important. We need to educate them and let them know that a use of a car seat or a seatbelt should be non-negotiable for all occupants. Seatbelt use in children is 2 times more likely when the driver is also restrained. Children 12 years old and younger should ride in the back seat, and you should never place a rear-facing car seat in the front seat. Also, all occupants should be restrained every time they are in a vehicle. So how can we improve this social issue? Well, there are ways to increase compliance. The first is with community campaigns. In the past, these have been very successful for raising awareness about car seat use, installing seats properly, and having car seats available to rent or purchase for a low price. It was also reported that better results were seen when the parents were told weight requirements rather than age. And lastly, healthcare providers can play a vital role in compliance due to the increased number of well-child visits and asking about car seat use during these visits. It's very important that the healthcare provider takes time to address car seat and seatbelt use while the parent and child are both there. And then I have my references listed here and here. Thank you for listening.